Premarital sexual counseling. We've all known about premarital counseling and its importance because premarital counseling la vandu we need to talk about health issues, namalku edavadhu hormonal imbalances irukka, undiagnosed diseases edha irukka like diabetes and hypertension, and also look at our genetic issues. Nama family reediya edavadhu genetic problem irundha, is it affecting us அப்படிங்கிறதையும் தெரிஞ்சுக்கலாம், and also look into our fertility. The third will be the most important thing is the fertility, because nowadays a man and a woman we are getting married very late in age. So ungaloda fertility level up therinjikittu adukapra kalyanam pannikiradungatho it's very important. Also there are certain supplements which a woman can take even before she gets married or she is planning for a pregnancy is folic acid supplements, which is very important for the growing baby. Premarital counseling abdin varappo it is also about understanding between each other, how do we sort out a conflict. And marriage abdingadhu it's a union between two people, so there will be a lot of adjustmental difficulties. Getting into a new family will be a difficult task for the woman, or getting into a new city or a country will be a difficult thing. So idella vandu psychologically handle pandradhu da premarital counseling. Ipa pudusa what I am trying to say is a premarital sexual counseling. Why am I talking about premarital sexual counseling is in infertility, it's an infertility center, we are seeing a lot of infertile couple coming to us, out of which 10 to 20% of the people, men and women together, have sexual difficulty. So இது ஏன் இந்த sexual difficulty நம்ம முன்னாடியே அட்ரஸ் பண்ணக்கூடாது, முன்னாடியே தெரிஞ்சுக்க கூடாது, even before we get married is something which every one of us should think, because by the time they come for a consultation they are married for 5 years already or 7 years already, and their age is more than 30 for sure. So 30 years ku mela avanga vandu paakrappa it is not just the sexual difficulty we are addressing, they are also having other added on problems like sugar irukkalam, high blood pressure irukkalam, and also they might have low fertility level. So these things become an added on difficulty to address during a fertility treatment. So if you can have this premarital sexual counseling even before getting married, or at least a sexual education even before getting married, I think that will be beneficial to this 20% of couple. So 20% is not a small number, and we should definitely talk about it. When I was looking into premarital, are we thinking about Western countries or India? Do we have premarital sexual difficulties in India? I see two things. One, there is very lack of awareness, though there is a lot of internet videos, pornographies, everything available for sexual education, but still there are a lot of people who are not aware of what is happening and how they have to undergo the entire process. And second, a lot of increase in premarital sexual intercourse is also happening in India, which we think it's not happening. Around, when I looked at the statistics, it says around 20% of young men and women are having premarital sexual incidents. So it is right time that we talk about these things. They might have some difficulty. It is better to open up even before marriage, understand each other's difficulty, and then get into a relationship. In India, especially in Tamil Nadu, the statistics says the incidence of premarital sex is around 35%, which is quite high when compared to, this is a study released by the Vellore Medical College. So human sexuality is a very complex relation between our psychological needs, our sexual needs, and the physiological needs. So, and also it adds on to our social and cultural values which we carry forward. So what are the sexual difficulties which we can think of is, first, we don't have a proper sexual behavior. We need to have a sexual hygiene, which is not being taught to anyone. And third will be gender orientation. Nowadays, orientation of a gender abdingadhe starts from a young adolescent girl or a boy. So what kind of gender they are oriented is something which is very important, and it's better we talk about it earlier. Because I've had couple who've been married for 5 years and who came to me for IUI treatment. They just opted IUI directly. It was not my decision. I was wondering why they want an IUI. The husband especially wanted an IUI. Later we found out the husband is a gay married to a woman out of family pressure and social pressure, that he didn't want to have a sexual intercourse at all, and he wanted the wife to have a child through some other means, that is IUI. So these kind of marital issues can be handled if it was openly spoken about or accepted even before the marriage happened, rather than getting married and spoiling the entire life of one another girl or a man. Fourth will be the other sexual difficulties like fear towards having a sexual intercourse, which is called vaginismus. Sometimes the young girls are brought up in a belief that sexual intercourse is a very difficult and a painful thing, which, or they could have had a childhood abuse or bad experience, which will develop inside them, so that after marriage it comes out as a vaginismus. Vaginismus is a psychological condition where the woman has a fear towards sexual intercourse, and this is a very bad issue to have. And I've seen couple coming after 7 years of marriage, it's not a short time, it's 7 years of marriage, having vaginismus. They couldn't identify what was going wrong and whom to approach and whom to talk about. So these things have to be addressed even before marriage. Take them for a counseling, take them for a pelvic physiotherapy, where the condition can be completely cured or 100% cured even before getting into marriage, or as soon as she's getting into marriage. And the other issues like premature ejaculation, erectile dysfunction, these are male problems which could be addressed even before getting married or as soon as getting married. And there are treatments, or at least we can give them a proper guidance that these are treatments which are available and they can achieve a pregnancy within a year or as soon as they get married, so that they don't delay their entire process. Also, we need to talk about the anatomical differences between a man and a woman, and hormonal differences between a man and a woman, and emotional differences between them. So if we understand the differences, I think it is easy for us to take it forward for future. Because I've had couple coming from IIT Madras, married for 3 years, not consummated at all, not planning for a child at all. When I asked them why they were not even trying to get pregnant, they said they're praying religiously for 3 years so that they get a healthy baby. So they're sitting and doing all pujas and prayers, and finally I found out that the husband didn't know what he's supposed to do. And to hide that, he's convinced the wife saying, let us pray for 3 years. And this was a highly educated couple, they are not an ignorant people. What kind of education we have and what kind of understanding or knowledge we need in a sexual activity is totally not related. I think it is a time that we should talk about it openly, so that they have a good marital life and not any further difficulty in their sexual life.